I'm Carla Curtis. I'm the Chief Diversity Officer for the College of Social Work. The College of Social Work here at Ohio State collaborates with dozens of human service organizations who are providing services to a very diverse population. In the college, we teach in the classrooms, but we immerse ourselves in the lives of many with whom we interact and with whom you will interact as students placed in agencies. Throughout your time here in the college, at the university, you will encounter individuals who are challenged by, who are working through personal, emotional, spiritual, and physical challenges, crises. We have assembled a group of professionals who are going to share with you how you can best connect those that you may encounter with the services that are provided in the agencies they represent.
The Collegiate Recovery Community is a specialized support program for Ohio State students in recovery from drug and alcohol addiction. We provide recovery support services along with a positive peer community so that these students can have an authentic college experience. And it's an incredibly diverse group of students. So we have everyone from 18 years old, they're a first year student, all the way up to graduate and professional students, folks in their 30s and 40s. And then everything in between. They come from not only the Central Ohio area, but all over the United States, and a couple from all over the world, all different majors. And so it's really great to see that, despite it being a really diverse group of students, we all have one thing in common, and that's that we're all in recovery, and that's what we rally around. If you encounter a student that is in recovery, is seeking recovery, or needs recovery, we would encourage you to do a warm handoff with that student. So either walk them over to the CRC, and we're located in Lincoln Tower, or ask their permission first, and if they say okay, then do an email introduction with us or pick up the phone and call us. Because if we can go and meet up with them and talk to them, we can immediately start to connect them to not only our program but other resources that will help them be able to enter and sustain long-term recovery. So a warm handoff, get them connected to us, and we can then take it from there.
Bhutanese Nepali community is a new community come from a small country in Himalayan country between India and China. There are about 35,000 people in central Ohio. We started to settle here since 2008. Ever since, we are growing exponentially. Also, we are facing a lot of challenges. Number one, substance abuse in the young youth, domestic violence, and elderly population struggling to adjust with the new culture. The suicide rate in the Bhutanese community is more than double the general US population. And the domestic violence, we need more awareness and education around the domestic violence. If anybody comes across the crisis in the Bhutanese Nepali community, the phone number is 614-396-8965. Or you can reach out to me at 720-422-9978.
I work for North Central Mental Health Services. So I'm here specifically at Stonewall Columbus, the LGBTQ community center here in Columbus. So we serve the LGBTQI community. So it's lesbian, gay, bisexual, transgender, queer/questioning, and intersex. We serve that general population. Crisis transcends, sexual and gender minority identities. Crisis is crisis, and it's the same kind of across the spectrum. There are some cultural things that really do play a role, but the main important thing, especially when there's a crisis going on, is making sure that that person is safe and that they're supported in that moment. And also with keeping that person supported and safe, making sure that you're safe. So not going into a space where you're at risk of getting hit, kicked, spit on, yelled at, any number of those things. It's about questioning people and kind of, there's a method called QPR. So it's question, persuade, and respond. And it's about talking with these people and just kind of generally validating feelings and realizing that these feelings are normal and they happen. Persuading them to find a reason to live while you wait for a responder to get there.
I'm Shivani Edwards, and I'm the Assistant Clinical Director here at Counseling and Consultation Service. We offer a wide variety of services for our students here to help them manage everyday life and enhance their ability to perform academically. We offer comprehensive mental health services for individuals. We offer 30-some groups to support and improve personal growth. And we also offer educational workshops about stress management, anxiety, and depression. We at CCS serve over 4,000 students, and we have over 40 staff who are able to provide services in multiple languages and really focus on diversity themselves. We have a social justice mission with our agencies and specifically like to work with students who struggled with feeling marginalized or dealing with issues related to their family or their stressors here on campus. If you see somebody in need, whether it's your roommate, somebody in your class, somebody that you're working with and you're concerned about them and they're an enrolled student here at The Ohio State University, you can always reach out to us for consultation. We talk to students all the time about how to help other people. You can also be with your friend or colleague or other student and contact us via phone at 614-292-5766.
Buckeye Ranch is a big mental health and behavioral health service provider. And the Somali Outreach Program is part of the community-based programs at the Buckeye Ranch. The last time I checked, the average families that we serve a month is around 1,600 families a month, not individuals, the families. The biggest thing is what we call the adjustment problems, families that are involved juvenile justice system, families that are involved children's services, families that have children with the problem with the school system, children that are AWOL, substance abuse, and many other behavioral and mental health issues. These problems, some of the problems are caused by the merging of the two cultures. For example, some of the children, when they come here, they never had what's called a formal education back home. And when they come here, let's say if they are 15, they go to the public schools, all of a sudden they are sitting in a high school class without no educational background. So that causes a lot of stress and depression and adjustment problems. If you see a Somali individual that has mental health or behavioral health crisis, you can call the Somali Outreach Program. You can call our clinical supervisor, Shri Patrick. Her phone number is 614-306-4052.
The Ohio Suicide Prevention Foundation works especially with coalitions across the state of Ohio. We currently have approximately 80 coalitions across the state of Ohio, and we also work with loss teams that are dispatched at the time of a death that is suspected to be by suicide. And so we don't do direct service, but we work with organizations and with various disciplines such as social workers, educators, nurses, coaches, to get the word out about suicide prevention as a health issue. Our concern is that not only do individuals who are in psychological distress have the ability to ask for help, but we want to encourage everybody that you are a gatekeeper, and as a gatekeeper, regardless to your training, you can help to save lives. And part of what you can do to help save lives is to recognize signs and symptoms of psychological distress, approach a person and assist a person in getting help. So we know that with these various systems that we are empowering thousands of gatekeepers over the 10 years almost 11 years that we have been in existence.
Yeah, one of the unique things about our counseling services is that Our services are outreach, which means our therapists go out into the homes and the schools and the community. The fact of the matter is, there's a lot of barriers to people getting to agencies or getting to offices, and quite frankly, the type of kids that we serve, they're just not going to go to get mental health counseling once a week to get therapy. That's just not the type of people that we work with. In our outreach counseling program, we do have Spanish-speaking workers because of the growing Latino population in the city. We also have a Somali worker who works specifically with the Somali population. One of our newest programs that we started is for the LGBTQ population of teens, primarily because it's a specialized population because of the homelessness rate, because of the suicide rate, the isolation, the depression, the domestic violence. When we see elements like that are starting to jump out, we then examine whether does it fit into our traditional outreach counseling program, or does it require specialized training? And we decided that these were significant enough that we needed to have a specific program, so we developed the PRIDE program. Anyone can make a referral. Teachers can make referrals, ministers can make referrals, parents can make referrals, kids can make referrals for themselves. 96% of all of our services are free. So we put it on ourselves to try to find the funding to make sure that these services are accessible and are free, and we reduce all barriers that we possibly can.
I'm Kevin Dixon, Vice President for Community and Cultural Engagement for the Alcohol, Drug, and Mental Health Board of Franklin County, more commonly known as ADAMH. ADAMH is responsible for the planning, funding, and evaluation of publicly supported mental health and addiction services here in Central Ohio, and particularly Franklin County. We're just so delighted to be able to serve such a diverse community, whether it's working with the Native American community, the Somali community, the Bhutanese and Nepalese community, the West African community, Eastern European community, Iraqi community. We try to serve a wide range of services to a wide range of populations. Ohio State University College of Social Work offers a lot of opportunities, but a lot of faculty members can only do but so much on campus. So that's why we're a resource here in the community, so that you can come outside of the Ohio State institution and be able to come out and participate with some of our providers, whether it's a practicum or an internship, or whether it's going into a primary health care facility where we do integrated health, or you can participate maybe in a recreation center on weekends and evenings where young people with lots of challenges are showing up with mental health and substance use issues, and being able to serve them right then and there in their community outposts that are more natural to where they will receive help than sometimes coming into some of our organizations. Many of the organizations that you heard from that we fund provide a wide range of services in the community as well as their organizations. So we want you to get to know those individuals, and feel free to contact us anytime you have any particular questions. We're really excited about you being there, and I think once your faculty members give you an opportunity to see what's happening within the institution, that you take the time to come outside the institution to be able to engage in a more holistic way.